Hi guys, I hope you're all doing good. So today I'm going to talk about the nucleus. As it says here on the picture, with great power comes great responsibility. And it is true, since nucleus is the most important organelle in our cells. The nucleus is a membrane-enclosed organelle that contains most of genetic information, and also it controls growth and reproduction of the cell. It is common center of all eukaryotic cells and is commonly the most prominent organelle in the cell. So here's the basic structure of the nucleus. It has a nuclear envelope with nuclear pores, nucleolus in the center, usually in the heart of the nucleus, nucleoplasm, and chromatin. So now I'm going to talk more about every part of it in detail and tell about their functions. First, we are facing the nuclear envelope. Nuclear envelope consists of phospholipid bilayer. The space between the phospholipids is called perinuclear space, and the inner membrane surrounds the fluid called nucleoplasm, which is very similar to cytoplasm. It's covered by a network of intermediate filaments that extend through the entire nucleus. The functions of nuclear envelope is first to separate the nucleus content from the cytoplasm. Second is to help to maintain the shape of the nucleus, and the third is to assist in regulating the flow of biomolecules through the nuclear pores. Now let's go to the nuclear pores. Through the entire membrane are small holes called pores, which allow material to pass from and into the nucleus. The structure of pore is a protein complex that extends throughout the nuclear membrane. And the main function of the pores is to help to transfer ribosomal RNA, ribosomal units, proteins, and polymerases, for example, for translation, between the nucleoplasm and cytoplasm. Now let's talk about nucleolus. It is contained within the nucleus. It is dense and membraneless structure composed of RNA and proteins. It contains proteins and RNA that help to synthesize rRNA that will be found in the ribosomes. It has a few functions. So first is to synthesize ribosomes by transcribing and assembling ribosomal RNA units. These subunits join together to form a complete ribosome during the protein synthesis. Second is to form a signal recognition particles. And the last one is that it also plays a role in the cell's response to the stress. Now I want to do a short review of protein synthesis. The nucleus regulates the synthesis of proteins in the cytoplasm through the use of messenger RNA. Messenger RNA is a transcribed DNA segment that serves as a template for protein production. It is produced in the nucleus and travels to the cytoplasm through the nuclear pores in the nuclear envelope. Once it is in cytoplasm, ribosomes and another RNA molecule called transfer RNA work together to produce proteins. And now I want to show you how the DNA is actually in the nucleus. Inside the nucleus, the very long linear DNA is wound around histones. The combination of 8 histones forms a nucleosome. Nucleosome can be wrapped into coils of protein, DNA, and RNA complexes, and it becomes a chromatin. When the DNA isn't used, it exists in the condensed form as a chromatin, but once it is needed for replication or for transcription, it's uncoated by special enzyme. And here is a video of how it actually happens.
In this animation, we'll see the remarkable way our DNA is tightly packed up so that 6 feet of this long molecule fits into the microscopic nucleus of every cell. The process starts when DNA is wrapped around special protein molecules called histones. The combined loop of DNA and protein is called a nucleosome. The nucleosomes are packaged into a thread known as chromatin. This fiber is then looped and further packaged using other proteins which are not shown here. The end result is that the DNA is tightly packed into the familiar structures we can see through a microscope: chromosomes. Chromosomes are not always present. They form around the time cells divide, when the two copies of the cell's DNA need to be separated. At other times, as we can see now after the cell has divided, our DNA is less highly organized. It is still wrapped up around the histones, but not coiled into chromosomes.
Now I want more to focus on nuclear lamina. That might be new for you. So the nuclear lamina is a dense 30 to 100 nanometers thick fibrillar network inside the nucleus of most of cells. It is composed of intermediate filaments and membrane-associated proteins. Besides providing the mechanical support, the nuclear lamina regulates important cellular events such as DNA replication and cell division. So that is how it looks under the microscope. It's a mesh-like system. So lamins are very important because over 200 diseases have been associated with mutations in the lamin genes. For example, muscular dystrophy, peripheral myopathy, and premature aging, progeria. And we'll talk about this disease a little bit later. However, the reason of these mutations are still not clear. Here is an example of what can happen to the nucleus if there is a mutation in lamina protein. If it is phosphorylated, as it's shown here, it disassembles nuclear envelope and cell dies. So now I want to tell you about the disease called progeria, and if you don't know, it's premature aging, when kids look like adults. Here you can see the comparison on normal to the left and abnormal to the right cell nucleus. In normal cell, DNA encodes a protein called prelamin A, which is later attached to farnesyl group, and this group helps the protein to reach and incorporate into the nuclear lamina and provide support to the nuclear envelope. Later, the farnesyl group is cleaved, and so you can see to the left how the normal nucleus look like. However, in the abnormal conditions, farnesyl group is not cleaved, so it forms like a pile of proteins. And actually, one of treatment for this disease is to block the addition of farnesyl group. So to the left, this is how the normal nucleus looks like, and to the right is abnormal, or how the nucleus of the patients with progeria look like. Although kids are born looking healthy, children with progeria begin to display many characteristics of accelerated aging within first 2 years of life. Progeria signs include growth failure, loss of body fat and hair, aged-looking skin, stiffness in joints, and a lot of cardiovascular diseases and strokes. The children have a remarkably similar appearance, and most of kids die at the age of 14 because of heart disease. The diagnosis is usually suspected according to signs and symptoms, such as skin changes, abnormal growth, and loss of hair and body fat. Also, genetic tests for lamin A mutations can confirm the diagnosis. Most treatment options have focused on reducing complications, such as cardiovascular disease. However, around 5 years ago, results of the first clinical drug trial for children with progeria has shown successful use of farnesyltransferase inhibitor, or FTI, and first this drug was used as a treatment for cancer, and to the right there is a picture of how treatment affects the nucleus. So on the top here there is a normal skin cell, here is the progeria skin cell, and the progeria skin cell treated with FTI, so you can see it looks a lot like a normal skin cell. Also, occupational and physical therapy can help the kids keep moving if their joints are stiff. Still, few people with progeria exceed 13 years of age, and at least 90 of patients die from complication of heart attacks and strokes. That's it what I wanted to tell you today, and thank you for your attention.